Good morning, Emily. It's always lovely to see you. Thank you for inviting me for this podcast. So, my name is Sangeeta Pathak. I am consultant obstetrician gynecologist, currently working in Mediclinic City Hospital, Dubai. Thank you for bringing me here. And my background is that as a young doctor, I moved to Zambia and I had an amazing experience working in the largest tertiary referral university hospital, and that is actually my foundation for my obstetrics and gynecology. Then we moved to UK and I was in NHS system for 20 years, and I think that has just strengthened all my skills in obstetrics and gynecology really amazingly well, and I feel very confident. And my last very rewarding 12 years as a consultant working in one of the Cambridgeshire hospital, that's kind of brought my best, that I really enjoyed looking after women with obstetrics and gynecology, but particularly my special interest has been the high-risk obstetrics and the fetal medicine that I've been working as before moving to Dubai.
And what was it about the high-risk pregnancies and fetal medicine particularly that drew you to specialise in that area?
I think as I was going through the training in United Kingdom in NHS, I had an amazing people who were working as the fetal medicine specialist, and I was really drawn to that kind of niche work that they were doing, and that ultrasound and all these kind of things always fascinated me. I knew right at the beginning of my career that obstetrics was my forte, meaning I was more comfortable looking after women with pregnancy or their complications. And why into high-risk pregnancy? Because I felt that I became part of these pregnant women's life.
Yes.
Because there was a lot going on, whether it's an underlying medical condition or whether it's something else that they already had before pregnancy and now they're pregnant. Obviously, pregnancy, it's a situation where women are, by default, a little bit anxious and nervous, especially the first-timer moms. They don't quite know what's going to happen. Yeah. It's a very unpredictable journey that you don't know what's going to happen next moment. And if you, on top of that, you've got some underlying medical conditions, that makes your journey a little bit more anxious.
Yes.
So to become part of those women with that journey really fascinated me. I felt like part of their pregnancy journey. I felt like I could make a difference.
Yes.
And I could look after them.
Amazing.
With my knowledge and skills, and that's what really drawn me to that kind of area.
And what was it that made you decide to relocate to Dubai at this particular point in your career?
So I had, as I said, 12 rewarding years as a consultant, and I am so thankful to the NHS system that really drilled me its evidence-based approach and the patient-centered and multidisciplinary approach. While I really appreciate that, but I felt that I needed to spread my wings a little bit more.
Yes.
I'm always driven by let's do more. And I felt that the skills and the training and that I've had, I could take that to a different geographical location. And while I was researching into what can I do, then came Allocate Assist, and I had a discussion with your team first, and then you, and I'm thinking, is she really a legit person? Is she really as good as it sounds? And you know that last year, as I was visiting my parents, then I decided to come and stop by. Initially, my husband wasn't really sure that was the right thing I was thinking about, but we came together to see you in your office.
Yes.
And after meeting with you, and you've got that infectious energy in you, Emily. After meeting with you, my husband was more convinced than I was. Oh. He said, yeah, perfect. It's fine. Let's go for it. So thank you very much. And you've got amazing members in your team. And I'm not surprised why your team is so successful. Everything you made things like a seamless. So I came into touch with your team, which were amazing, each and every person. And then I thought, why not Dubai? Because Dubai is a vibrant, multicultural, forward-thinking. At personal level, I'm thinking it's going to help me grow, but professionally, I know that Dubai healthcare is world renowned. You get all latest modern technology, and you've got evidence-based practice here as well. So I felt science is science. Medicine isn't going to change, but I could bring these skills into the very similar, but yet different and a vibrant. So therefore, decided for Dubai.
And what was it about Mediclinic in particular that appealed to you?
So there were actually a few things about Mediclinic. I am a very rationalized person, so I always put pros and cons and everything. There were a couple of things that really drawn towards Mediclinic City Hospital. One of them that I see as I was doing my research, that it is one of the first in Dubai healthcare city as a multidisciplinary hospital. In this hospital, you get from a simple health consultation to robotic surgery to transplant surgery. And that really fascinated me. And the other thing that fascinated me, that even though it's a corporate world, but you still have a global JCI accreditation. That meant to me that everything and anything that we do within this hospital, it gets measured against global standards, which was very reassuring, that there is a quality assurance that I'm very used to from NHS system.
Yeah.
So it was very reassuring to know that they follow those global JCI accreditations. And the next thing was the multicultural people in it. In my induction program, the HR head said they have about 200 nationalities people. So I feel as a person, you grow when you work with different background people. You learn a lot on a daily basis, as well as professionally you grow, because everybody brings their own flavor. The next thing that drawn me towards Mediclinic City, that is, it is one of the few healthcare facilities which are BFI, which is a baby-friendly initiative, where mothers who've just delivered, over 90% women are having a skin-to-skin contact with their newborn baby. And we don't have to talk about the importance of it, as well as they will be breastfeeding immediately after delivery. So again, having seen these BFI initiatives and standards, that really drawn me towards Mediclinic City, which I felt that these are the kind of things that I was trained in from NHS, and I am doing in the similar kind of background, but more modern and all kinds of facilities that you can see that it's available. Yeah. So I'm working in a more niche environment, and that makes me proud to be part of this kind of environment.
Yeah, because that's one of their main areas of focus, isn't it? Women's health. And
absolutely.
The obstetrics and gynecology services.
Absolutely.
And could you just, what was it, the BFI?
BFI, yeah.
BFI. I've not heard of that. Is that not something that's implemented?
There are a number of standards that you have to be compliant with. It's a national, it's an international initiative. Okay. So I know in UK we had that the hospital had to do certain things to be compliant with that BFI, baby-friendly initiative.
Yes.
So that's what I see. I see this separate staff that is looking after this area. Yeah. So that kind of gives me that reassurance that, okay, there are women, and especially my area of interest is pregnancy and high-risk women and delivery. So that gives me a kind of very pride to be working with such a team.
Wow, that's so inspiring. Yeah, it's got very, very high standards of patient care, very professional.
Absolutely.
Yeah, that's why they've got a really good reputation in the market, because they're one of the biggest groups in the UAE. So that's really, really nice to hear. So overall, how has your experience at Mediclinic been so far, and how can you compare it to other hospitals that you've worked in previously in your career?
It's been absolutely amazing journey. Learning, positivity. I was initially nervous about having worked in NHS, which is a government sector, not worked in the private sector. How am I going to translate my experience and skills? But I feel that having a supportive staff and the team at Mediclinic has been amazing. They give you that space to settle down initially. Yes. And they slowly get you into full-blown clinical situation. So that was really good. The difference I see, I feel the science remains science. Women deliver the same way, no matter which corner of the world they are. But the difference that I see, while I was instilled with evidence-based practice and policies, and very much policies and protocols driven in NHS, I feel that Dubai gives you opportunity not only to follow those policies and protocol, but also to horizon your skills, and it gives you that opportunity to work in an absolute state-of-art facilities. But the biggest difference for me was to learn about insurance, which was quite a challenge.
Yes.
I wouldn't say that I have mastered these things. I am learning. This is very early days. But I feel that I have translated my skills and my clinical practice without any issue. But I am still learning this private corporate world, especially with the insurance system.
Yes.
So which I know it will come with time.
Yes.
But it's work in progress.
And would you say there's scope to continue with your research and education interests here in the UAE?
Most certainly. So I had a privilege and the opportunity to work at a senior leadership roles in research and education back in UK. And I am very passionate about research because I feel whatever we do today and whichever way we look after our women, that's as a result of research, evidence. And I already see that Mediclinic City Hospital has got a very close and strong link and association with MBRU University. And there is already, I've spoken to the staff from MBRU. They are very keen, not only just for education, but also for research purposes. So this is something that I feel they already have foundation, because I've seen that there is a research and development office, as well as they're setting up, and I see that lots of local staff, the staff working in Mediclinic, they are presenting their work, papers, and publishing it and presenting their work in different conferences. So that gives me a kind of reassurance that there is a culture of research and teaching young doctors. So yes, that's something that I would like to explore and take it further in the coming times.
Thank you so much, Dr. Sangeeta. It's been really amazing to catch up with you today. I'm so proud that we introduced you to Dubai, and you've been absolutely amazing to work with, and you've also become a very good friend. So thank you very much for your time today.
Thank you very much, Emily. And again, thank you to every member in your team. You have been absolutely instrumental in people's life, and I can say this from my personal experience. Things that I felt that I could do it myself, all these things is not a problem. Little did I know, not only is it a time-consuming process to get to Dubai, but it's also a very complex process. I could not have done it without your help. So thank you very much for your help. And not only helping to get doctors here, but you actually keep in touch on a constant basis. And you become like a friend and family. Thank you for that, Emily.